Hello, everyone. I'm Anne Opayemi, and I'm a project manager with the technology-enabled care team. So today we'll be looking at the GP online access system. And this is also known as GP DACS. It's a system where the patient completes an online form in their own time and submits this form to the general practice team. So this is then reviewed, assessed, and responded to by the relevant healthcare professional. Some of you may have heard of solutions such as eConsult or Amy's Online Consult or Ask My GP. These are all examples of an online access system or a GP DACS. General practices can decide whether to use the online access system as an addition to other existing services they offer where appropriate to meet patients' access needs. This system is not intended to replace other methods of access, such as telephone or face-to-face. It's a service for patients who are confident in using digital services, and no one will be forced to use it. Practices must ensure that protocols are in place for patients who may need assistance to access healthcare services in other ways. So I'll just go to the background, just to give us a bit of that. During the pandemic, many new and different ways of working were developed to support the continued delivery of critical services. We might know that these new ways of working were born out of necessity, but in many cases, they also delivered improvement. The Scottish Government has endorsed proposals to pursue a national approach to be taken for the provision of an online access system for general practices within Scotland. The government is investing in multidisciplinary teams to increase capacity in primary care, and this will allow patients to be seen at the right time, in the right place, by the right person, and also help reduce the general practitioner's workload. The Scottish Government seeks to support the adoption of GP DACS in all practices that wish to participate in the national approach. And general practice is at the heart of the healthcare system. And the priority for primary care services is improving access for patients as the first point of contact within the NHS. What I'll do now is to talk you through the patient's journey. We'll be looking at a patient named Sandy for this purpose, and she's suffering from a long-term condition. She's been managing this condition for a couple of years now. However, so a few days ago, she started experiencing different type of symptoms. So she has never experienced this one before. So she decided to contact her GP. She's heard about the GP DACS system, the online access system. And so she reaches for a phone and goes to GP practice website, locates the online access system. She first of all tries to use some self-help resources. However, she's not been able to get the answer she's after. So she decides to log into the system. So she provides identification details. This would then enable her access the request form, where she types in all the symptoms she's been experiencing. And because Sandy understands that the information she's providing alongside her medical records is what the healthcare professional would use to be able to understand her symptoms, thereafter provide the best advice. So she then goes ahead to check and confirm all that she's entered as the symptoms, and submits the request. And she immediately receives acknowledgement and response time frame, and also a link to give feedback on the service. Afterwards, she receives a response from the GP practice team. And in this case, she was given an option to either come in for a face-to-face appointment or a video consultation. We all know that in this case, in Sandy's case, it was a clinical request, but it could have been an administrative request where someone wanted either a sick note or a fit note, or maybe even another type of clinical request. So, and in that case, the response would have been maybe slightly different. They could have been signposted to a pharmacist or physiotherapist, or, by any appropriate communication channel. What I'll do is to just talk briefly about some of the benefits of an online access system. It provides more options for how, when, and where care is provided. And it allows patients to provide relevant information, increasing the likelihood of obtaining their desired outcome. It also allows the practice team to triage and prioritize requests, ensuring the most urgent requests are responded to quickly and are directed to the most appropriate person or service. It allows the practice team to make more informed decisions relating to the patient's requests through access to their medical record and information provided by them. It improves patients' access to advice or consultation by providing an additional mode of access alongside traditional methods such as telephone, face-to-face, and walk-ins. So this just brings me back to you. So would you like to access your GP online? Or would you not like to access your GP online? We would like to know your views on this type of service. And we're putting together an event on Tuesday, October 12th, 1:30 p.m. It's just where we'll discuss this system in more details. This system could be for you, for me, for everyone. So by all means, if you're available on that date, come along and we'll be happy to have you. Thank you very much.